Hey there, YouTube fans. How you going? Long time no see, eh? Hey, I thought I would do a video on chronic fatigue syndrome, and it's something that it pertains to me. It looks like you'll see in some of my videos, those people who follow my channel, that just setting up the equipment, and you can hear it in me now, I get really fatigued just doing that. And I wanted to share with you what happens for me, how I got this diagnosis finally after so many years, about 7 or 8 years. Here's some of my current symptoms. Fatigue, strangely enough. And it's been several years. Now, they say that it can be surgery that can cause chronic fatigue, or an illness like a virus or glandular fever or something like that. I mean, in my case, I had a cancer surgery, and I have diabetes and sleep apnea. So kind of all of the things, a perfect storm, if you will, to have chronic fatigue syndrome. They call it myalgic encephalomyelitis chronic fatigue syndrome, or ME/CFS. And I'm choosing to do this today because I have a little bit more energy than usual, which is great. Anyway, I don't want to go on. I have dry eyes. I have interrupted sleep. It's really strange. I get really, really tired, and then I go to bed, and then I can't sleep. Sleep, and when I wake up in the morning, for some strange reason, I don't know if other people, please comment in the comments if you do have CFS. I don't know why, but the mornings and up until, say, 7 o'clock at night is harder for me. It's really strange. So if that happens to you too, and you've been diagnosed with CFS, let me know. Sleep doesn't recharge me, and you probably see I'm struggling to find words, and you'll see this in some of my videos because we get brain fog. I have my brain kind of, it's like a mix master sometimes. It's really hard to explain. It's not clear, and it's overactive, and that's probably why I can't sleep sometimes. So anyway, I don't have any physical endurance. I have lethargy and low motivation. For example, just to do this list, I'm reading off a list that took me weeks to do. I didn't even want to do that on the computer because everything seems to be a struggle. Now, with any of these things, please check with your doctor. And a good idea, and this is some good advice, is to write a list of your symptoms and take it to your doctor. Also, I'll talk about some other things later, but exercise. Now, some of the treatment, they say exercise, but exercise makes me feel worse. It may take me days or months to recover. I used to go to the gym, but I couldn't handle it. You have what's called a crash. So you might have a good day, you might feel fine, and you try and get everything done because we always put things on the back burner, and then you just crash. Like you're in bed, you don't want to do anything, you sit on the couch, you don't even want to cook, you order takeaway food or takeout, as Americans say. And as I mentioned before, you got brain fog, you got concentration problems, you got memory problems, you got you're distracted, lack of focus, lack of comprehension. It can be very hard to even read a book. I'm trying to read Gary Times' book, Good Calories, Bad Calories, and I can't get through it. As I said, you find it hard to find words sometimes. Now, this is a really amazing thing, and I didn't realize this was related to CFS. It's low tolerance of alcohol. So 2 glasses of wine makes me crash. I have to go to bed. I like just about pass out. Kind of makes me a cheap drunk, I suppose. That's really, really weird. And I was kind of tipped off to this when I was in Italy. I always wondered why, after having lunch and having a couple of glasses of wine, I had to sleep, which is not so bad in Italy because we have the siesta. Anyway, I digress. I have night sweats as well. Wake up with the pillows drenched and my back drenched. Muscle and joint pain. My whole body feels stiff. And I seem to hurt from my toes to my head, my neck, my shoulders. It's all stiff. I feel like, I don't know, like a surfboard. Swollen glands. They told me I had scans done of my prosthetic shoulder, and the glands underneath there are swollen, like chronically swollen. My tonsils are always big, that they're really swollen as well. So that's a couple of things. Itchy throat or red throat and reflux. So some people have a sore throat. I just get reflux. So digestive problems like indigestion, heartburn. You can have gas, and it's funny here. I've got on my list. I'm repeating things. There you go. That's typical brain fog. Flu-like symptoms. So in my case, I get allergies and sinusitis and sinus pain and congestion. And I'm allergic to sulfites, so you can have chemical allergies, chemical sensitivities. I know, for example, dried apricots, they've got a lot of sulfites in there. Red wine, they've got sulfites in there, and they just set me off. I mean, with just bad sinus pain. Some people feel dizzy. I know when I go to the fridge sometimes and have a drink of water, I have to hold the wall. So there is some issue there with dizziness. You can feel weak, like your legs feel weak. You feel like sometimes I feel like I've got a lead suit on, and I've told doctors, I feel like a vampire has bit me. One doctor said, he's an endocrinologist, he goes, is that a good thing or a bad thing? And I thought, that's right. If you're a vampire, you become immortal and you're like very powerful. No, what I'm trying to say is I feel like a vampire sucked me of all my blood and that I have no energy anymore. That's what it feels like. I get fast and irregular heartbeats. I get palpitations. I get pounding beats sometimes. It's a bang, a thud. And shortness of breath. And this is really weird. I got dry eyes here twice. I told you I'm repeating things. So, of course, when you feel like that, you're going to have... Let me catch my breath for a second. You're going to have depression, of course. If you don't want to go out and see your family and your friends, and you feel like crap and you have no energy, of course you're going to get depressed. And and it's hard for some people to have the doctors not think that it's in your head. You need to tell them that, no, it's not necessarily in my head, it's in my body. And my body, how I feel, is making me get depressed, I get anxiety, I get irritability, which means, you're cranky. Loud noises and crowds and dogs barking. So there's a sensitivity to sound that I have. It's almost like painful. And I know some people, they're so bad and they're in their beds that they have to have ear muffs on, which is, thank God I'm not that bad. Tinnitus, which is a ringing in your ears, like non-stop. Psoriasis in my case, I've talked about that before. Nausea, bloating. And they say that some of this could be related to like systemic inflammation. And I've put a note here and I told my doctor that some clue to the cause of this CFS is when I took prednisone for sinusitis, it's a steroid, I felt cured. I felt fantastic. I felt like everything went away, all the pain and all the energy came back. And I think that this is my theory now, that it dampened down the inflammation, you see. I've had hot flushes and then cold flushes. So you feel hot, like you have to turn the air conditioning up, and then you feel cold, like, my goodness, it's 26 degrees Celsius, but I have to turn that off or down because I feel cold now all of a sudden. Again, heart palpitations. Isn't that interesting? I didn't realize I've repeated it in there several times, the same things. Sometimes I don't even have the energy to have a shower, but I do, but it takes a lot of energy. My jaw even fatigues when chewing. How weird is that? Electronics give me a headache, like headphones give me a headache, so I can be sensitive to electronics. As I said, I feel worse in the mornings. I've actually lost weight, but it didn't help. So the first thing doctors look at and they go, "Oh, you're overweight. That's why." No, I've lost actually at least 10 kilos of fat, and then I put on all this muscle, or like 16 kilos of muscle. So that's 26 kilos that my body rearranged, and it didn't make a lot of difference. Back pain, especially in the morning. I constantly have to conserve energy or pace myself. For example, if I collect the washing, off the clothesline, I do a deal with myself that I will fold and put away the clothes later. Sometimes this takes days to get the energy to do it. I can't cook from being so fatigued sometimes. I order takeaway food, or takeout, as Americans say. I have to bargain myself all the time to do anything due to the mental and physical fatigue. For example, if you take the rubbish out, Sal, you can have a glass of Diet Pepsi. I have to kind of do deals with myself to get moving. I often say no to socializing with my friends and family due to mental and physical fatigue. And they kind of, sometimes they give up asking because you say no so much, which is very isolating, I got a big in bold here. No, it's not just in my head. I feel it in my body too. I'm highly educated. Please don't be dismissive. As I said, some doctors can dismiss you. I'll go into... I've had all sorts of tests, which I'm going to talk about soon, but you just keep on saying, "I've got fatigue, doc, I've got fatigue, doc," and they'll do all these tests, and they'll find a few things, but nothing that explains the chronic fatigue. I know what feeling well feels like. I used to feel well. So in my case, I have some comorbid problems, and these are also related to chronic fatigue syndrome. So I wanted to mention them. I'm telling the world all my health problems, but some people, they do have these comorbid problems that go along with this. Sleep apnea, I said. Diabetes type 2. I'm a cancer survivor. I had osteosarcoma in my left arm. Left arm it was, yeah. I was treated with several rounds of chemo and steroids. You also, irritable bowel syndrome can be part of this, can be related to this. Obesity can be related to this. Hypertension, which is high blood pressure, can be related to this, which I do have. Hypogonadism can be related to this, which we've talked about, testosterone replacement therapy on this channel. Fatty liver, and I have chronic diverticulitis, which is inflammation in your intestines with the pockets that develop in your intestines. And some of the tests that we did to diagnostic tests that we've done, they've checked my cortisol levels, which are normal. They've checked my thyroid levels, normal. Sleep apnea, yes, got it, but I got a machine. Diabetes type 2, yes, but I'm on medicine and it's well controlled. Iron levels, they were low, but they're mostly normal. Vitamin D levels, because I'm an introvert, I'm always inside, even though I live in a sunny place, were low. I've had celiac tests, that you're gluten intolerant. I'm not gluten intolerant. I've had multiple of those. Multiple blood tests. In my case, okay, what helps then? Caffeine. The stimulant, caffeine, seems to help. Sugar seems to help, which is strange. Like if I have lots of sugar, which I shouldn't have, like a whole bunch of lollies, we call them in Australia, you call them candy, I feel fantastic for some strange reason. Steroids, which we talk about, but they're dangerous and they can put on weight, and like prednisone, they make me feel better. What makes it worse? Stress. Stress makes everything worse. Exercise, exertion, pushing myself makes it worse. Lack of sleep, poor sleep makes it worse. Some medicines like antibiotics make it worse. All right, that's 16 minutes. I hope this helps somebody out there. Please like, comment, and subscribe if this did help you. Please, leave a comment. To pay me back, if you enjoyed this video, if you got something from this video, please subscribe, because right now I don't have any support for this channel, and I'd like to keep building this channel. Guys, watch some of my other videos. Thanks for watching. God bless. Teacher Sal out.